Hello, and welcome to Chapter 2, Key Highlight Video, Orienting Frameworks for Social Work Practice. The core message that I have for you guys is how we understand the client situation will shape how we respond. Because what's important is for us as social workers and clinicians is to understand the situation so we can respond intentionally with genuineness and empathy, and we can be more effective. Okay? Those frameworks that we're going to discuss today in this chapter aren't for you guys to memorize. However, they are a way for us to look professionally into the problem and guide how what we notice and it's correct. Okay. Hello, and welcome to Chapter 2, Key Highlight Video. Chapter 2, Orienting Frameworks for Social Work Practice. The core message that I have for you is hello and welcome. Hello and welcome to Key Highlight Video. Right here. Hello and welcome to Chapter 2 Key Highlight Video. Chapter 2, Orienting Frameworks for Social Work Practice. The core message that I have for you guys through Chapter 2 is how we understand the client situation will shape how we respond. The frameworks that we have for today in this chapter that are being discussed is to provide a professional lens that guide our assessment. It will help us to what we notice, how we understand the situation, how we view it, what the client's perception is, and where to begin. Because those frameworks aren't to be really memorized. They're mostly to be used as a guidance in how we can view the issue or the situation that is presented to us. Because the client hardly come to you with one simple problem. Mostly a student in the schools, like I have come across a lot of students in the schools who are struggling academically, mostly have an anxiety as well, or they're experiencing bullying, or they have limited support at home. So it is not just one problem. Let's explore those frameworks and let's see how it can help us really look into our assessments more deeply. The first perspective that we have or framework is the ecological system. This is where we're looking into the client within a system, how the client interact with the system around him. And it's not one system, it's multiple systems. We're looking into how they're interacting with their family, with their school, with their work, with their culture, with their community. If they're part of a spiritual entity, how they're interacting with that. Or the healthcare system, or the social policies, or the news that's being delivered to them. That interaction is so important. If I'm a social worker and I'm adopting this perspective or this framework to look into the issue, I'm looking if this system is really creating more barriers into the client's issues or is an asset. It's a positive, it's a plus, right? Because understanding that, it will help me preventing the question from asking what is wrong with the person and actually asking what is happening in the person's environment that's really challenging them from changing, or that's actually a plus and it's helping improving the situation. Because if it's a plus, absolutely, we're moving forward with it. If it's challenging, we're going to look into how we cross those barriers. So that's the ecological system perspective. Now, if I'm looking into the strengths perspective, this is when I'm truly not focusing on the issue or the problem. However, I'm pointing out patients' strengths. I'm looking at their coping skills. I'm looking at positive relationships in their lives. I'm looking at cultural knowledge and how their culture is impacting their lives, whether it's creating more barriers or it's an asset, right? Because most of our decisions that we make, it's based off of our values, belief system that got passed down to us through our families, through our culture, through our religion. So look into that. We're looking into their faith because faith is so important. And a lot of people really adapt it as a strength where they move forward in their issues. They reach out to prayers, they reach out to their pastors, to their spiritual entities that they are part of. So do they have that? We're looking into their persistence. We're looking into their resiliency. We're looking into their past experiences, whether it's created successful stories or not. We're looking into past successes as well. We're asking ourselves here, or like we're asking ourselves while we're examining or we're assessing the situation on what helped that person survived, or what is already working for them, or can we include something new into that entity and help move forward, right? That's what we're looking for. Or what gives them hope, or what gives them strength. Honestly, just having the client sitting in your chair and asking for help, that's a strength. Acknowledge that. Bringing those to the surface, let our clients be aware of them, is so helpful because it will add in more positive aspect to the issue than negative. It will give them another perspective to look into the issue versus just focusing on the problem. Because if we have a problem personally, if I'm really dealing with an issue or a matter or a problem that I have in my life, my focus is the issue. I hardly look into it or look into any other positive aspect or into any other strengths in my life. So having that person coming in and really pointing those strengths as a social worker, adapting that perspective is great and is a huge to the helping process. All right. Now, when we're looking into the next one, the anti-oppressive practice, this is where social workers, honestly, looking into more what's causing barriers into the client's situation. Really, here, social work does not happen within a neutral system because, as I've mentioned, it's an interaction between your client and system. This is when we're looking whether the system created any racism, poverty, sexism, embolism, immigration status, English as a second language, for example, or a language access because interpretation isn't available, right? I have come across a lot of patients in the health system where barrier was the language because there hasn't been interpretation services available to them. What we did, we advocated through the system. We looked into interpretation services that we could provide to those clients so their health issues is being addressed fairly, just like any other. So looking into that or adapting that perspective in our practice through our assessment, we ask, who's in power? Who's being excluded? What barriers is being created for my clients? Is my client being marginalized here? How could I help them move forward with the system, right? And the system and the example that I gave you in the healthcare, interpretation services is so essential. And if we don't advocate for it, clients are gonna be pushed to the side, marginalized, not have access to a fair treatment. All right. Looking into the next one, trauma-informed practice. When we look at trauma-informed practice, I practiced a lot of that and I adopted a lot of that when I worked at the VA. Our veterans do experience trauma heavily when they're on combat or during services, and it really impacts their lives, not just on a daily basis, honestly, not just when they come into us with issues. It explains it really, really well. It really sometimes affect their lives in very simple things as much as really taking public transportation. If the veteran is really relying on public transportation and they're not comfortable being in the open with a lot of people in a bus, then it will prevent them from seeking care needed. So with the trauma-informed practice, we emphasize safety, trust, choice, collaboration, empowerment, and cultural awareness. You do not know, guys, how much we paid attention to really just office setup within the VA to make it so trauma-informed, to make it so safe for them. We dim lights if that's needed. We make it so available for them where they're by the exit, by the door. They're sitting out there and they can exit, and they can, as well as letting us know when to stop, not when to stop and not further asking more questions. We really accommodated phone appointments instead of in-person appointments. A lot of people don't feel comfortable being in person with other peoples as well. We accommodated people and veterans with matching them to the right social workers. I was asked by some of the veterans not to be seen by me, and asked for other social workers because I'm from the Middle East. That background that I have, cultural background, really triggered my veterans who's served in Desert Storm. So accommodating that to them is really important, is really helpful, because it's not about you. It's about the client that you are serving. And we're not just focused about veterans, we're looking into different trauma. So check in with your clients. Look at any symptoms that being presented to you. For example, any guardedness. If patient is hypervigilant, is patient is a little more angry or distrust, those are in labels that we use to say, oh, client does not want it to engage. Those are red flags that we need to pay attention to as a trauma-informed therapists or clinicians who are adopting this perspective to understand the client's situation. Pay attention to those symptoms. Don't label them as avoidance or resistance. Those are doors that you guys need to knock and open and explore more and accommodate your clients. All right. Now we're looking at evidence-informed practice. This is more about research, because in our practice, we do research, we do have data, and we have some frameworks that truly, or interventions that could guide our practice. However, what I like for you guys when you adopt this practice or this framework is to pay attention to or balance it with the client preference, the culture, readiness, available resources, and real life circumstances, because what is being adopted or what is being implemented in that research study could not fit my client's preferences or cultural background or language barrier or the resources that I have available here in the community. We have a pretty limited resources in New Mexico, guys, and sometimes those evidence-based informed practices that come off of data and research are not idealistic or realistic to be even really practiced in our community because of lack of resources. So pay attention to that. Ask yourself, what does that resource suggest? Does it fit my client? Does it really culturally appropriate to use with my client? Is it realistic? Is it acceptable? As I've mentioned, for example, DBT, dialectical behavioral therapy. DBT is an evidence-based informed practice used with some of the personality disorders. But if I have a client from a different cultural background or religious cultural background, right? That framework might not work. So pay attention to that. Balance it where your client is and what does that research really inform in me. We can take an its and pieces of it, but not fully, because one size does not fit all. Pay attention to that, okay? Perfect. When we talk about cultural humility, as I've mentioned before, be curious, be open, don't be afraid to ask the perfect question. There isn't a perfect question, guys. Just be open. Approach it with genuineness, with empathy, and stop assuming. Don't walk in with assumptions. All right? The takeaway from this final chapter, or what I have for you guys to take away from this chapter, when we look at the ecological perspective, we're looking at systems. When we look at strengths, we look at capacity. When we look at anti-oppressive practice, we look at power and barriers. When we look at trauma-informed, we look at behaviors and compassion. When we look at evidence-based, we look at knowledge and responsibility. Balance those, okay? And when we look at cultural humility, we remain curious, but self-aware, okay? Now, the question that I have for you, the reflection question that I wanted you guys to think about is, which framework feels most natural to you? And which one challenges how you usually understand people and problems? Because effective social work isn't about choosing one lens. It's about knowing how to hold multiple lenses at the same time so we understand the client more fully and respond more intentionally. Thank you.